that they gave to scientific motherhood varied among nations and classes and across racial and ethnic groups, but we can draw some generalizations. As the prestige of science and medicine grew, the growing authority of science and our increasing dependence on technology shaped childcare advice and women's responses to it. For example, the emerging science of bacteriology altered women's domestic tasks as housekeepers were taught how to battle germs for the sakes of their family. Developments in domestic technology, which were spreading around the globe, like electricity, plumbing, the stove instead of the fireplace, the refrigerator, the washing machine, all these dramatically transformed the scope, the content, and the status of women's work, and not only for middle-class women. Other social and cultural factors need to be integrated into this analysis. Declining family size, along with a fear for continuing high infant mortality and morbidity rates, made each child that much more precious. One sought the best, most up-to-date information for the sake of one's children. Then, too, economic considerations encouraged the spread of scientific motherhood in both the commercial world and the professional world. Manufacturers found that promoting science helped to sell products. Also, since scientific motherhood remained popular for advertisers, they must have believed that it was a successful tool for advancing their sales. Doctors found that pediatrics provided a lucrative door to an expanding medical practice. The element of gender is crucial in this analysis. Experts addressed women on the basis of their biological capacity to bear children, and because they were seen as acting out of instinct when an element of social control was needed. Experts were most frequently depicted as male, usually physicians. Science, medicine, and professionalism in general were described in male terms. Yet, this doesn't mean that scientific motherhood is merely a case of male physicians intervening in the lives of their female patients. Whether viewed as passive recipients or self-directed searchers of knowledge, mothers were actively involved with caring for their children, negotiating between the instructions of medical practitioners and scientific experts and the realities of their own lives. We cannot homogenize women's responses to or seeming acceptance of medical and scientific advice. Only by understanding the specificities of their lived experiences can we see the complexities of the decisions they made. As cultural theorists remind us, there's a concrete politics of reception, one that is a crucial determinant in how messages from experts are received and used. Mothers' decisions about childcare were highly personal, shaped by a woman's experiences, beliefs, values, and situations. Take, for example, the case of Mrs. A.J. Johnson. Her doctor insisted that Johnson feed her infant son just so much and no more, and at regular hours. Under this regime, the baby got cross and fretted a lot more than he should, acted as though he was hungry, but according to the doctor's orders, he shouldn't have any more and not oftener than 2 hours. This left a crying baby and a very frustrated mother. Then Johnson decided that her son appeared hungry, and she was willing to do anything to help him. So she fed him as much as he wanted, after which he slept fine. Soon Johnson reported that her son was sleeping well every day and was growing as well. Johnson's doctor had suggested one routine, but her lived experience indicated another, one that provided a solution for a starving infant. She trusted the physician because he was a medical authority, but she was not so blinded by his expertise that she ignored common sense and her powers of observation. We cannot know how many women had the self-confidence of Johnson to follow her own judgment. We do know that over time, as women read, heard, and saw more of scientific motherhood, they increasingly turned away from traditional female sources and their own experience, and more to an authoritarian, patriarchal physician. And different women had different reasons for doing so. Clearly, some women chose to care for their children according to the directions of child care experts because as mothers, they were convinced modern medicine offered the best and most healthful counsel. Antibiotics, insulin, surgery, and the like, the benefits of modern medicine, provided women with tools to protect the health and welfare of their children. Scientific developments in sanitation and nutrition explained previously inexplicable ill health. Mothers were willing to follow the directions of physicians because of the promise of health. Similarly, mothers who lacked self-confidence, who felt they lived in a fearful world over which they had no control, gratefully accepted the advice, the rules of an authoritative counselor. Once they accepted modern medical advice, often they accepted modern medical advice because they believed that modern medicine provided health-giving options in a dangerous world. It led them to gain some control over their frenetic lives and many family and household demands that they faced each day. They understood the benefits of medical counsel and the need to gain control over their intense lives. In making their decisions, they considered both the medical and the pragmatic. It was the conjunction of these two, as with Mrs. Johnson, that molded mothers' practices, a conjunction that still continues to influence mothers' lives today.